right, so let's get started. So this is our first webinar of 2023, so welcome. We're going to go over a couple little housekeeping rules for you. So just as a reminder, this webinar is recorded and you will receive a link to that recording as well as a copy of Sarah Borders' slides that she will be presenting today. This webinar is interactive, which means that you can ask questions in the Q&A and you can also chat using the chat feature. We will save Q&A for the end, but you can submit a question at any time during the presentation. So let me introduce Sarah Borders, our compliance specialist. Sarah is an industry leader in providing guidance on legislative and regulatory topics such as ERISA, ACA, COBRA, HIPAA, Medicare secondary payer, FSAs, HRAs, HSAs, DCFSAs, all those lovely acronyms we know our HR people love to deal with. In her previous roles as a VP of Benefits Compliance with NFP and Director of Compliance with a regional benefits firm, she's served hundreds of employers' compliance needs from identification to resolution. She's written dozens of articles on regulations and frequently presents on compliance topics like she is today. She is an active board member of the Austin Association of Health Underwriters and a member of the NAHU Legislative Council Employer Working Group. Her designations include an active license with the Texas Department of Insurance, CEBS, Certified Healthcare Reform Professional, NAHU HIPAA and ACA certification, and Healthcare Service Associate with AHIP. She holds an MBA from Texas A&M Corpus Christi and a BE from the University of Incarnate Word, Corpus Christi. Thank you so much for joining us, Sarah. Welcome.
Thank you, Cassie. Good morning, everyone. Thank you for joining us today. I'm sorry to hear that you're looking at a blizzard up in Wisconsin. I live in Texas and we were covered in ice just 2 weeks ago and now it's 80 degrees today. So I understand crazy weather. So thank you all for joining today. What we're going to do is go through some of the new requirements for compliance as well as some timely reminders, mostly related to ACA reporting. In other words, those 1095C forms, 1094Cs. Hopefully a lot of you are working on those, or maybe some of you are done with those. Maybe some of you aren't sure if you're supposed to be doing those. So I want to focus on them because they are highly enforced and an employer can wind up with a lovely IRS penalty letter and maybe didn't know some things that could mitigate, the possibility of getting one of those letters. We're going to talk about the first, though, we'll talk about the CAA, the Consolidated Appropriations Act of 21, and these RxDC prescription drug and healthcare reporting submissions to CMS that maybe you've been hearing about, maybe you're very familiar with them. Maybe you're not really sure what that is. We're going to talk about it because it applies to every group health plan out there. No one's exempt. We'll talk about the transparency and coverage rules, which is really on both sides of the aisle. The buzzword for today, mental health parity and transparency, is kind of all the rage up in Washington. And so it's trickling down to employer group health plans. So we'll talk about what you need to know for that. Also, we did receive an announcement signaling the end of the COVID-19 emergency periods, and that does also impact group health plans for fully insured and self-insured. So I want to get you ahead of that so you know what to expect. No huge deals there, but just so you know how to administer your plan and how to, go ahead and make decisions based on this winding down of these COVID emergency periods. And again, we'll look at the ACA reporting and other rules. Okay, I want to start off with a poll, and I always kind of like to ask this question. Many of you have attended our webinars, and I know I've done compliance checkups with a lot of you as well, but I'd love to hear if you can put in the chat box, not the Q&A, but the chat, how you're feeling, how confident do you feel before we get started today about meeting your company's health plan and employee benefits obligations? Are you A, pretty confident overall, you're on top of it? B, you've got some work to do, you know better. C, feeling a little nervous already and know you need some help. And D, you know that you are totally lost and not compliant at all, which no shame here. We want to know, get a sense of where our audience is at. I know some of you are Housing Group employees, but if you are an employer, could you just type that into the chat and we'll get kind of a gauge and see where you lie on A, B, C, or D. And hopefully you all can see the chat feature.
It looks like I'm not seeing anything come in, so I'm going to check our settings here. Looks like chat is disabled.
Chat is disabled. Oh no.
One moment here, and we will pick that up for you guys. Sorry about that.
No worries, no worries. Just a fun little gauge to see where we're at. And I know that many of you have, you know, maybe come into your role, you're new to your role, maybe someone else was doing the type of role that, you know, brought in benefits and maybe you're doing something else. So I want to make sure that I understand sort of where everyone is at. And if we can't have the chat enabled, that's okay. We can move on, but we'll have another poll question at the end.
For the sake of time, we will just use the Q&A. So if you've got the Q&A posted up, why don't you just put your answer in there? All right, we're seeing B, A, B, A, C, B. Lots of confident people. We love to see it. Some B's,
Yes.
B's, B's, B's.
I see that as well. A lot of B's. So I'm seeing that bell curve. Well, hopefully today we can, in some ways, make you feel maybe a letter up, but some of you might go down a letter. Don't worry, though, if you feel a little less confident after today's webinar. We are here to assist you in many different ways. We have resources. We have our compliance checkup, which some of you have already done. So don't feel as though you're sort of left alone to do and deal with these things. It's meant to just, you know, illustrate this, introduce you to it if it's new to you, and help you to know what to do next. All right, so first of all, let's talk about this thing called the CAA prescription drug and healthcare reporting. You're going to see it referred to mostly going forward as RxDC. So just keep that word or that acronym in your mind. And that's going to be what we focus on primarily today, because this is really probably the biggest deal since the ACA came into law almost a decade ago, as far as it relates to employers and what they had to do. So what this is essentially is a requirement that came as a result of the CAA 2021. It was a piece of legislation that was passed under the Trump administration in late 2020 that brought with it a host of requirements mostly related to transparency in health insurance and health coverage. And so a lot of confusion was around this. We weren't really sure exactly what this meant. And that's typical with legislation. You see sort of the directive in legislation, and it tends to be more general, and it will direct the agencies, Department of Labor, HHS, Treasury, and sometimes other agencies that are more cursory to employee benefits to make regulations. And they get into the weeds about how they're going to enforce the law that was passed under Congress. So we oftentimes don't know exactly how a piece of legislation is going to impact employers specifically until we see the regulatory side of things with the comment period. And then they tell us, okay, these are the final regulations and here's how you need to comply. From then, it's even left to the people working at these departments, and in this case, to take those regulations and turn it into a software platform. So all of this has just been a total frenzy for the last 6 months about how to comply with this requirement, both from an insurance carrier side, from a TPA perspective, and even for employers that are having to submit this themselves directly to the CMS on the CMS portal. So if you're not familiar with this, all group health plans, that includes grandfathered plans, small group plans are not exempt from this, and non-ERISA governmental plans all have to comply with these RxDC submissions. And issuers, meaning insurance companies, carriers, have to report prescription drug and healthcare information directly to CMS. The information that's included in these reports, in these submissions, and if you kind of look at it, it's a lot of Excel formatted documents that contain a lot of data on them. And you can see what they are, what it contains in these Excel documents, what it's requiring to be submitted from your group health plan. Total spending broken down by cost, and that would include hospital, primary care, prescription drug, and then past that, we have specifics related to the prescription drug costs, brand name drugs, most costly drugs, the top 50 with greatest increase in spending, number of paid claims, rebates based on therapeutic class, and top 25 drugs that yielded the highest amount of rebates. So you can see that's extremely technical, not information that you have. It's information that your health plan or your TPA, if you're self-funded, or even your PBM, prescription benefit manager, would have. But you can see the first one, the first bullet, isn't prescription drug related. It is related to medical claims. And so that is what has made this even all the more complex, because it's not simply just prescription drug information. It really does include hospital claim information, primary care visits, mental health visits, and also includes employee and employer contribution information. So all of this is essentially uploaded using a specific spreadsheet template to CMS on their RxDC portal. And many times this was due for the first time, and I'm going to go through the due dates and kind of the delays and so forth. But we are really dealing with a whole new requirement that is so incumbent upon carriers and TPAs to at least assist you, if not do it for you. What we've seen in the industry for the first go round of this was at first a lot of TPAs, specifically if you're self-funded, a lot of TPAs who were saying, yes, we will do this, or we'll do a portion of this, but we need information from employers to be able to do it on their behalf. And then as kind of time went on, we saw a lot of maybe pull back on that and saying, well, we're going to provide you with the information, and then employer plan sponsors will be required to submit. So if you're fully insured and you have, a Quartz plan, Dean Health, Blue Cross Blue Shield, Anthem, United Healthcare, fully insured plan, an insurance product, the carrier would have submitted on your behalf, most likely, even if you had changed carriers over the past few years. So pretty complicated, new requirements, no getting around the complexity of it. But I do think in time, the industry will catch up with this requirement. It won't be as big of a deal, but the first couple go rounds of this has been a frenzy, so to speak. Let me go through some timelines and some delays. So December 23rd, we got some frequently asked questions. You can see that was 2 days before Christmas. We heard from the Department of Labor in a set of FAQs that they were issuing a delayed enforcement policy for the first submission deadline for 2020 and 2021 submissions only. So they extended that original deadline of December 27th to the end of January. We are in February now, and some plans were able to get that submitted by the end of January, or some carriers, TPAs, other third parties were able to go ahead and get that submitted by the new deadline. But some still are still having such problems, technical reasons, not knowing this existed until, after the holidays were over, many reasons. But we're past the delayed enforcement. But I do know, and I believe that the CMS portal is still open. And if you are still working with your carriers or TPAs, you want to make sure that they still get this done, even though we're technically past the submission deadline, because this is the first time that this is being submitted. And I think at this point, and kind of judging by being on many, many CMS webinars, they don't want to just hand out penalty letters or penalties to employers. And in fact, they don't have that authority to just hand out a penalty for not submitting. Instead, they want to assist employers, give extra time where possible, where allowed by law, But that doesn't mean you just don't have to do it. And keep in mind, this first submission is for the 2020 and 2021 calendar year. So information that went on during those calendar years was due by January 31st, 2023. Right on its heels, the 2022 information for all of the ones I just went through here, all of this enrollment and premium information and all this healthcare spending and drug information, that has to be submitted by or before June 1st, 2023 in the same manner to CMS on their website, same process, same templates, same information, but relates to the 2022 calendar year. So even if you have a non-calendar year plan, you may have information that maybe was with one carrier for part of the year and another carrier for the later half of the year. All of that information has to be submitted to CMS by the due date. This due date is every year going forward, June 1st, by June 1st, every single year. There's no end to this in sight unless Congress ends it somehow. But this is going to be an ongoing every single year requirement. So it's something that we're all going to have to look at, have to deal with, and have to really kind of force the market, meaning TPAs, third-party administrators, in other words, medical claims payers and carriers to submit either on your behalf or provide you with the information. Other flexibilities were included in the set of FAQs. If you have gotten more into the weeds on this, this might be something you actually know about, but really all you need to know is that there were multiple submissions by the same reporting entity were allowed. Multiple TPAs and PBMs can submit the same data file for the same plan. There was some confusion about that before, but they've confirmed that one TPA could submit what they have and a PBM may submit what they have and use the same report, and they don't have to necessarily reference each other. There also is a simplified submission for self-funded groups who can just simply email CMS if they're only submitting a P2, a D1, and a narrative response with no other data. So some of you may have done that. Some of you may be very familiar with these requirements. Others of you may not. So at this point, what do you need to do? So I've listed this based on sort of your funding strategy. Fully insured, meaning you purchase an insurance product from a carrier. Again, like Dean, Forts, Anthem, United Healthcare, Aetna, Humana, Cigna. You know that you're fully insured, and that if you're not sure, please ask your housing group rep. But most of you know whether or not you're fully insured or you're self-insured. So if you're fully insured for those years, remember, we're looking back at the prior reference year. You want to confirm with your carrier, and maybe you've already heard from your carriers. A lot of the carriers are sending out information asking you to collect, plan information, some information so they can submit for you. So you'll want to respond to those. Make sure you're paying attention to those. If you get one of those and you're not really sure what it's saying, please reach out to us and we can assist you with that, because that is what you want to respond to in time so they can submit in time. Don't ignore them, in other words. So you want to confirm, if you haven't heard from them or you can't find any emails, whether or not the carrier will report all of the required aggregate data on behalf of your plan, including any plan-specific information. And you want to obtain that confirmation in writing, because yes, the carriers do submit on your behalf, but ultimately the plan sponsor is responsible to make sure that this is happening because it relates to their plan. That's how these regulations and rules are written. Whether or not we agree, I don't necessarily think that's the best route, but that's what we're given. That's what we're dealing with. So I want to be realistic with you. Self-insured plans, however, when you're self-insured, it is a cost savings. It's a trade-off though, because self-insured plans, because they fund their own claims, they purchase stop loss, they own their data, it means more responsibility. It's just like if I rent a house, I call my landlord, I call the manager and I say, hey, I need all this stuff fixed. You need to do it for me. It's the same concept with self-insured. When I buy a house, I'm responsible. Get the benefits of ownership and the equity in the house, and I save money in some aspects, but I'm responsible to do those fixes and to pay those costs, to make sure things are happening, to make sure my foundation is not sinking into the ground, all of those things. Same concept with a self-insured plan. The responsibilities are greater. Now we hire TPAs and other carriers to help us comply, but they are not responsible for complying. Ultimately, the employer, plan sponsor, self-insured plans are responsible and hold that bag because they've taken ownership of their plan. So I just want you to understand that you and your company are fiduciary. You have a fiduciary obligation, which is a heightened level of responsibility to maintain your plan, make sure it's compliant, make sure it's running, that your service providers are not charging you too much. There's a host of things that fiduciaries are required to do. So I'm saying this because I want you to have a concept of, just like you would with your retirement plan or other responsibilities in your job, this is not something you can just pass off to everybody else and you don't have to deal with it. This is something that's required when a company decides to sponsor a group health plan. These are the requirements that they incur, whether they knew it or not. So if you're self-insured, you'll want to determine the level of assistance from your medical TPA. If you don't know already, hopefully you already know this by now, as well as your PBM, your prescription drug benefit manager. Likely, if you're self-insured again, you'll have multiple vendors where you're going to need to coordinate data, or they will need to coordinate it for you. So there's a couple of decisions to make, because again, this is coming up again for 2022, and some haven't even submitted for 2020 and 2021 in the first go round. So you'll really need to discuss this and look at this carefully. Decide if a vendor will file on behalf of your plan. Or you can decide if a vendor will file some of the information, like maybe your PBM is going to file or has filed some of the information, but maybe the medical TPA isn't. Maybe they're just giving you the data. So you'll need to decide what you need to do and what's missing, and if you have a responsibility to upload this information yourself into the HIOS RxDC portal, or if you want to engage a third-party vendor to submit for you at an additional cost. Coordinate that submission strategy. So again, with the assistance of Hausman Group, we've been talking about this for about 9 months now and looking at this and gathering information about what carriers are doing what TPAs are doing what. You want to obtain that confirmation that they are in fact doing this. What are they doing, and get it in writing. If they say that they're submitting on your behalf, make sure that you get a confirmation of some sort in writing. Employers intending to submit any data directly to CMS will need to apply for a HIOS account. HIOS is a CMS portal where a lot of other information can get submitted through there, but it can take a little while to get approval from CMS. It can take a couple days or maybe even weeks to get your approval from HIOS and get that account set up. And then again, some employers with that limited data, a P2, D1, and a narrative response can just simply email it to CMS. But if there's more data that's required, you have to go through HIOS, or again, engage a third party to submit on your behalf. Going forward, monitor your service providers to ensure compliance by that first January 31st deadline. Request that it was submitted, request confirmation, review and revise going forward your vendor contracts and for future submissions to CMS, especially if you're self-insured. This is something that some TPAs have dug in their heels and said, we are not doing this. We don't feel like we're responsible for this, and they're just not going to provide you with any data. I don't know if that's the case with any Hausman Group clients, but I have seen where the TPAs, they just aren't equipped to handle this. So it may be time to look at another TPA who can assist with compliance. I know that that's not a popular response, but that's just the nature of this requirement. We're looking at an incredibly complex and technical requirement, a data that they hold, the TPA and the PBM hold, And so we need to find service providers that can assist with compliance and paying claims correctly. It's just the way it is these days. So, take this, kind of look at what's going on within your organization, especially if you're self-funded. And if you're really, really clueless and in the dark, we can have a call and talk through this. There are also some other transparency and coverage requirements that are not quite as hard as the one I just mentioned, the RxDC reporting for 2022, is that first bullet. We also have a couple of things that, for the most part, I've seen TPAs and carriers fall in line with and provide these publicly or in the format they're supposed to be for their employer plan sponsors that they work with. First, we have the price comparison tool. This was to be available for employees for plan year starting on or after January 1st, 2023. So most carriers and most TPAs already had price comparison tools of some sort, but they have specific guidelines, and the first 500 services you can see linked here in the slides that have to be listed on this self-service tool. This is employer facing or participant facing. This is supposed to help them identify the cost of care and to make better, more informed decisions on their spending for health insurance. We also have this interesting requirement to submit or provide to CMS, again, air ambulance cost data. This was supposed to be effective March 31st, meaning they had to submit it by March 31st this year, but we still only have pending guidance. We don't have any final guidance about how exactly that's supposed to be submitted. So either they will delay this requirement, or we're going to get guidance any day now, and there may be a bit of scramble with this as well, but this will pale in comparison to the first bullet for the RxDC reporting. So as we find out more information, we will send out alerts. So watch for any of that, but just know that I expect a lot of the TPAs to be able to provide this, but we'll have to just wait and see a little bit on that requirement. Last year, we also had an obligation for plans to provide a publicly available machine readable file that's been updated monthly. And that was to be sort of available, disclosed by July 1st last year. So you may remember this whole talk about MRFs, machine readable files. There was some clarification that if an employer does not have a public facing group health plan website, then they can defer to their carriers and TPAs to provide this publicly on their behalf, meaning you don't have to create a health plan website in order to post this publicly. You don't have to post this somewhere randomly on your consumer facing website. That's what we thought at first, because we just weren't sure, but they confirmed a couple months after the requirement was due or supposed to be posted that yes, in fact, carriers, CPAs could post this publicly on behalf if they didn't have a group health plan website, which most employers don't. The only employers that I know of that have a public facing group health plan website are larger universities, companies as big as like Dell or Cisco, very, very large companies where it's just easier for them to post their benefits online publicly for everybody to see. Advanced EOBs, we're still pending further rulemaking on that, mostly related to the transmitting of protected health information. So nothing required specifically for employers yet. And again, we expect that the TPAs, carriers, since you're paying them to issue EOBs, they will be able to comply with this. Couple other things just to note here: the No Surprises Act, which is the prohibition on balance billing. One more time, you're going to hear me say this a lot. Carriers, TPAs are the ones that are going to have to ensure claims are processed according to the No Surprises Act regulations. But, and it's highly technical. It involves negotiation a lot of times with the providers, the doctors and hospitals themselves. But for plan sponsors, just like the MRFs, if you don't host a public facing website for your group health plan, then the carriers, the TPAs, can do it for you on your behalf. Lastly, there's a prohibition under the CAA on gag clauses. So this is going to be really, again, more related to self-insured plans, but you want to get more clear on what does your service agreement say with your TPAs, your third-party administrators. They are not allowed to have any, or you're not allowed to enter into a contract with a TPA or carrier who has some sort of gag clause where they restrict the information from you being disclosed provider specific cost or quality of care information. Some of those contracts used to have that information. A lot of times I feel like this is being done in practice, though. They won't give over provider information because they feel like it's proprietary. It's proprietary to their product or their network. And so they're not going to disclose cost or reimbursement amounts of providers. So this is going to be of development, an area of development, and it's going to take your advisor, us, and you as the employer who is paying them to push back on these, show them these regulations, and kind of force the market to comply with the CAA. Quick update on the end of the COVID-19 emergency periods. Alerts were sent out a couple weeks ago because we did hear from the Biden administration. They announced their intentions to end these two different emergency periods that began as a result of COVID. So they said that as of May 11th, that they would sunset the public health emergency period and also the national emergency period. And what you need to know from that, as far as your health plan perspective, is in many discussions with a lot of you on compliance checkups, we've talked about the COBRA deadlines had to be extended. They had to essentially toll the COBRA periods and let the periods begin ticking again after 1 year, or until the end of the national emergency period. Well, now we think we know when the national emergency period is going to end. So that's supposed to be May 11th, and then 60 days following the end of the national emergency period will be the end of the outbreak period. So I know this is a little confusing, but what you need to know is that COBRA timelines, HIPAA deadlines to request special enrollment, and deadlines to file claims and benefits, which doesn't relate so much to what you're doing, but mostly COBRA and HIPAA deadlines will start to tick again as normal on July 10th, assuming we don't have any congressional action to move up the sunset date of the COVID national emergency period. Most of the COBRA vendors are very aware of these rules. They're complying with these rules and are watching them very closely to know when we need to stop the tolling period. For now, again, it's going to be July 10th because that's 60 days after the end of the national emergency period. Under the public health emergency, which is a different, similar but different emergency period that was declared, group health plans were required to cover COVID diagnostic testing and also over-the-counter diagnostic testing, those at-home kits. There was a certain amount that they had to cover. It was issued last year. So we can expect that to end as well, meaning that health plans will no longer have to cover COVID-19 testing with no cost sharing. You can have a couple of options here, and that will end again May 11th. So what you can do as the employer, if you're fully insured, the carrier is going to do what they do. They're going to make a decision probably to stop covering it right then. I'm not sure about that. Different carriers do different things, but it doesn't mean that they can't cover them. It just means that they don't have to any longer with no cost sharing. But if you're fully insured, if you're self-insured, again, you have a decision to make here. TPAs may reach out to you and ask you how you want to proceed. Maybe you have to opt in or opt out of how they're going to do it. Others may just wait to hear from you, or you could wait till the your renewal date, so that there's not some disruption in the middle of the plan year and requiring you to issue an SMM, summary of material modifications, in the middle of the plan year. So just keep that in mind, that if you're self-insured, you do have some flexibility in how you want to wind down, if you do want to remove this coverage of COVID-19 testing, at least with no cost sharing. Maybe you still want to cover it, but they have a deductible to meet at that point. Immunizations, including COVID vaccines, still have to be covered under the group health plan under the ACA's preventive care mandate. So immunizations like that, there's a whole list of them, but it's going to include COVID-19 vaccinations that still have to be covered with no cost sharing, covered as preventive care, but just for in-network providers. So it'll be a little bit different under the public health emergency end. So hopefully that is clear enough, but I would just say focus on the COBRA part of it and focus on whether or not you want to continue covering these COVID diagnostic tests and to what degree, or not at all. So next steps for those emergency periods, again, confirm with your COBRA vendor that the tolling period will end as of July 10th. Fully insured plans, you'll want to confirm with your carrier on what is happening. Maybe some of them aren't quite issuing specifics on what they're going to do next, because we're not totally certain that the government will actually end these emergency periods May 11th, because there was some talk about Congress ending it sooner. So there may be a little bit of a delay in hearing exactly what they're doing. And same thing with self-insured plans. You may want to wait just a little bit to kind of see if this actually does happen on May 11th, or will it be sooner? Mid-year changes, again, remember that will require a summary material modification within 60 days of the effective date of the change, either self-insured or fully insured, which just essentially means you have to issue a document that you call it a summary material modification, saying that this thing has changed under our plan effective May 11th or whatever. If you want to wait till renewal, then you don't have to issue one of these SMMs mid-plan year. Okay, getting into ACA reporting, I want to spend the rest of the time talking about this because there still continues to be a lot of confusion around ACA reporting, with good reason, because it's complicated. But I think by now, the first time that an employer would have had to do this, if you were an applicable large employer, was 2015. And so we're pretty far into this by now, and the IRS is sort of done with any good faith effort reliefs. They feel like you should know if you're an applicable large employer by now. They're sort of over, so to speak, any further good faith effort. And that's been reflected in the regulations, in the instructions themselves, and the issuance of these ESRP penalty letters. So first of all, the first thing you really need to know and be clear on, and we can help you with this for sure, and we have had several conversations over the last week about whether or not you're an applicable large employer, ALE. It's a really specific determination and calculation that will tell you based on the prior calendar year, whether you're an applicable large employer for the next calendar year, regardless of when your plan year begins. And so if you're not sure, if you're hovering around that 50 employee mark, including your part-time employees, and this again is not employees just on your plan, it's total full-time employees plus equivalents, which essentially is a calculation you get at by adding up part-time hours. So if you add up part-time hours, it's going to equate to full-time bodies using their calculation. So keep that in mind, that employers need to know, because the IRS expects you to know if you're an ALE, and therefore do you need to file the 1095-C series forms. I'll show you one of those in a screenshot in just a moment. If you're not an applicable large employer, maybe you're sitting there going, no, we're definitely not. We have 35 total employees, or we have 40 total employees. We've never even been close to 50. And you're fully insured, then congratulations, you don't have any reporting requirements. However, if you're level funded, if you have a self-insured level funded product that kind of looks and feels like a fully insured product, but it's level funded, and again, if you're not sure, ask us, then you have to file the B series forms. They're a lot less complicated than the C forms because they don't have all of this coding stuff and you don't have to comply with the employer mandate, but you still have an obligation to file the B forms. So again, it depends on how large you are. Are you an applicable large employer for the year or are you not? That's a determination you'll need to make every single year. And we send out a lot of information trying to remind you of that. So hopefully, if you're not sure, please get with us immediately to make that determination. And if you're just, maybe you think a couple of years you didn't file, maybe you are new to your role and you didn't file, it's better to know your options at this point on late filing versus not filing than to get a surprise letter from the IRS saying, we cross-referenced your W-2s and we think you should have filed. Here's your big fine, and you still have to file and you have to hire a lawyer at that point. So I don't want to be overly scary, but these are things that we see pretty common. It's easy for them to enforce this, and they do. I know many of you on the phone have gotten letters of some degree, and they can be pretty frightening, but if you handle it and we can help you usually get those mitigated. Again, under the instructions, they did clearly remove the good faith penalty relief. It's not available anymore for incorrect or late filings. There's an automatic 30-day extension to give out the 1095-C forms, which has been pushed back every year, and now it's permanent to March 2nd. So you do get an extra month to issue out the forms, the 1095-C forms. So that's good. Now actually filing with the IRS, you can do it by paper or you can do it electronically. You can only do it electronically if you're over 250 forms. So you get extra month if you file electronically to the IRS. Most payroll vendors, in fact, almost all payroll vendors will do this for you for an additional cost, of course, but I think it's well worth. If you have a great vendor to do this on your behalf rather than you doing it by hand or trying to do it in a spreadsheet. A lot of this does require oversight and some, checking, really depending on how capable your vendor is, but they can submit electronically on your behalf. They can populate forms on your behalf. They can get you pretty far in the process, and then maybe there's just some tweaks to make. Employers can file for an extension to file, but it has to be done on Form 8809 prior to the filing deadline. So if you need an extra 30 days, you do have to file for an extension in order to file late. So just keep that in mind that you can't just file late. You have to actually file an extension before that March 31st or February 28th deadline if you're doing paper. Now, some common errors here that I want to point out to you, and I'll show you again in the screenshot on the next slide. The ACA reporting is the employer plan sponsor's responsibility. It is not the carrier's responsibility. I still continue to hear this over and over again, and it's unfortunate that maybe some bad information was given to you. The carriers do, if you're fully insured, the carriers do submit the B forms. But if you're level funded and smaller employer, or you're an applicable large employer with 50 or more employees plus equivalents, you have to file the C forms, even if the carrier is filing their part with the B forms. So keep that in mind that it is not done by the carrier, and you will likely see an employer mandate penalty at some point for failure to file. Applicable large employers have to distribute 1095-C forms to full-time employees, again, by March 2nd, and you have to file the 1094-C and 1095-Cs with the IRS by the end of March. I keep saying the same things, but I want to just make sure that this hits home, and because it is a little confusing, and I want to make sure everybody understands. This is how you tell the IRS you're complying with the employer mandate. That means we're offering minimum essential coverage to at least 95% of employees that also meets minimum value, which is a higher threshold than minimum essential coverage. It's like a actuarial determination. Most regular major medical plans meet minimum value and minimum essential coverage, but it also has to be affordable. Affordability is determined by how much you pay of their premiums and how much they have to pay. And it's based on which safe harbor you decide to use, whether you're going to rely on what the federal poverty level is, or if you look at the employee's own information and their pay, you can use the rate of pay safe harbor or W-2 safe harbor to determine whether or not your coverage is affordable. This again is determined by the lowest cost plan, even if they take a plan that is more expensive. Maybe you have a buy-up option. It's based on the lowest cost plan for self-only coverage. That's the amount that you tell the IRS how much they pay. Coding errors and information mistakes are the number one cause of erroneous ESRP letters. Usually when I get an employer shared responsibility penalty letter, I go immediately to the table within the letter. And it's almost always not because you didn't offer coverage that was affordable or met minimum value, but because there was a coding error or a box was marked no when it should have been marked yes, which I'll show you in just a sec. What triggers this penalty letter? The only thing that triggers an employer mandate penalty letter is if somebody goes to the exchange and receives a premium tax credit, an employee of yours. That's it. If they all took the coverage, you will not be assessed an employer mandate penalty. It's only if they went to the exchange, applied, and received a premium tax credit, and there's something in your coding that doesn't say that they shouldn't have been offered this premium tax credit. So you don't just automatically, in other words, get an ESRP letter. You get one if somebody goes to the exchange, receives a premium tax credit or subsidy, and the coding that you've issued reflects some kind of problem with your ability to comply with the employer mandate, or that you did not offer enough coverage to your full-time employees, or you didn't offer coverage to enough of your full-time employees. That's really it. So that's the key here is, okay, we only have maybe one employee that went to the exchange and got a premium tax credit. That's how they assess penalty. So I don't want you to think that it's on everybody, or if you made one mistake that you're going to all of a sudden get one. It always turns on the PTC, the premium tax credit. Penalty letters, though, can be issued 2 to 3 years later after the fact. We're getting 2020 and 2019 penalty letters. So you can imagine if you think about what was going on in 2020 or 2019, maybe that was like 2 payroll vendors ago, or maybe you were brand new to your job and you wouldn't even know where to look for some of these records. So it's really important to get these forms right and keep good and accurate records, pulling and extracting data from vendors, because when you kind of fire a vendor, they take your data a lot of times with them and you have to pay them to get it. So make sure that you're keeping accurate records and not relying too heavily on payroll vendors for record keeping obligations. Now here is a copy, this is from 2019, but it looks the same, of a 1095-C form. And I put the little red arrows there on lines 14 and 16. These are the parts, 14, 15, and 16. These are the parts you have to get right. You really, really, really want to spend time making sure that they're coded properly, and that in most circumstances, there's not a line 16 that's left blank. That's where a lot of problems can come in, because you're telling the IRS that the employee didn't take coverage if it's blank, and that no other code applies. They didn't meet a safe harbor, and therefore, if they went to get a premium tax credit, you might owe a penalty on those months where they did, in fact, go to the marketplace and receive a subsidy from the federal government. If you're self-insured and also an applicable large employer, you will need to complete Part 3, the bottom part there, for covered individuals, including dependents. If you're fully insured but an applicable large employer, you can leave that section blank. Now, here's the number one culprit of penalty letters that I see. I automatically, and I'll show you where I go to look, is on your 1094-C, for some reason, these boxes are marked no that should be marked yes. I think this happens because Coding vendors or reporting vendors, payroll vendors are pulling information that may not be exactly accurate about who is actually offered coverage. There's some kind of blip in the data, and these really should have been marked yes. It's just some sort of software error. So take 2 seconds, look at your 1094C form and say, are all these boxes marked yes? Do not submit something that says no when it should be marked yes. So this will probably prevent half of the penalty letters out there from going out. Just make sure that things like this are intuitive, they make sense, they look correct, look through them, take a sample of them, and make sure everything looks correct according to your knowledge. And if it's not, find out why did this happen and get it fixed before you submit it over to the IRS, because they're not going to kick back this for an error because it's not necessarily wrong. You're just telling them incorrect information for your organization. Here's a copy, just a screenshot of an actual ESRP penalty letter that came from an actual employer. And this is what I continue to see over and over again with the big penalties at the last two months there. You can see that for November and December for this employer, and I think this was for 2018, they for some reason had marked on their 1094C no for the last 2 months, which wasn't the case. They did have minimum essential coverage for those months. And for some reason, their software system marked it no, and then they were awarded this lovely penalty letter of over $50,000 for the last 2 months. They did get the penalty abated, but they had to spend the time, they had to dig up their records, they had to send a bunch of information to the IRS. They may have to engage legal counsel to speak to the IRS on their behalf. So all of that could have been avoided. Most of this could have been avoided by correct coding and correct check boxes marked yes instead of no. I know that seems outrageous, but that's almost always the case of why they come. So next steps to avoid these compliance mistakes, and then we'll finish up and have a couple minutes for questions. And if you do have questions, please go ahead and type them into the Q&A box so that I can make sure to see them and answer them live if possible. And if I don't know the answer to something or want to make sure I look carefully at a more specific question, I will get back with you afterwards. So next steps to avoid compliance mistakes for ACA reporting. Review your 1095Cs and 1094Cs before submitting to the IRS. And if you've already submitted them to the IRS, we're still within that deadline. I would even look at them again. Because again, it's such heartburn to deal with these penalty letters that you don't owe and your company doesn't owe. So take the time, look over these forms, triple check them, quadruple check them, take a sample of somebody who maybe came and went during the year, maybe somebody who waived the coverage. What are the codes being used here? Somebody who maybe moved from part-time to full-time, does that look correct with the coding that was used? Just make sure that the forms look correct before the final deadline is due, because you can always submit corrected forms even now without any worry of penalties. File on time each year, make corrections to the IRS. They will kick back errors with like social security numbers, sometimes with spelling of names. Usually those will kick back and you'll know to correct them. Look at which safe harbor you're using for all of your employees or for a class of employees. Are you using code 2F, 2G, 2H? Is it listed under line 16, or is for some reason there a blank there where there should be a code present? And lines 14 and 16 should have codes for all months unless you're using the qualifying offer method code 1A on line 14. So keep that in mind. If you're using 1A, then you don't have to have codes or boxes filled in, but everybody else who's using code 1E should have a box in line 16 and an amount in line 15 filled in for each month where they were offered coverage. Review the part 3 of the 1094C, the cover sheet transmittal, to make sure that all months are marked yes. And where there's no offer of coverage, use the following code combos. You want to use 1H2A to say no offer of coverage, wasn't an employee, 1H2B, which is part-time employee, or 1H2D, that is they're in their waiting period. So just don't leave line 16 blank in most instances, unless no safe harbor applies and there's a small risk of a penalty in that instance. So to finish up, if you're able to, in the chat, to type in, give us a feeling of how well you've grasped the information that we reviewed today. Are you still pretty confident overall and on top of it? B, do you have some work to do, still manageable? Now, are you feeling a little more nervous and may need some help? Or D, are you now feeling just totally and completely lost? You're not doing any of these things. So type into the Q&A where you're feeling. I'm seeing A's and B's, good, still. 1C, A's, that's great. I'm glad to see that. I was hoping that most of you were on top of these and not hearing this for the first time. And I think Hausman Group, working with Hausman Group for over 3 years now, they are really on top of everything, and they put compliance first as a priority within the organization. So if you're not working with Hausman Group yet, you should be. We would love to have you as a client and help you with all of these things. Moved from A to B as you predicted. Well, that's awesome. If there aren't any other questions, and Cassie, I don't see any other questions posted into the Q&A, but maybe we'll hear from some of you offline later today with calls and so forth. So
yes, and that is a great segue into our survey. So we would love to hear what you thought of today's presentation, and thank you again so much for joining us. And thank you, Sarah, for such a knowledgeable presentation. Here are the SHRM and HRCI credits if you need your CE credits for the webinar. And again, this will be emailed to you, a copy of the presentation slides, along with a link to the recording if you want to rewatch or share with anyone you know. Thank you so much. And hopefully we see some questions in our survey. There is a survey question asking if you have any follow-up questions for Sarah. So you're welcome to put that in there if you'd like to.
yeah, please do.
Oh, does HG offer any ACA trainings? Sarah, do you want to answer that?
So we have a couple of things we can do. We have kind of a workbook that you can ask your contact, your account manager for. We also can jump on a call if you're wanting to discuss a specific area and get to kind of what it is that you're wondering about. So I would recommend just reaching out, sharing your concern or your question, and then we can go from there on trainings.
Wonderful. Well, we're ending right on time today, so hopefully everyone enjoys the rest of their morning, and thank you so much again for joining us.
Thanks, everyone. Have a great afternoon.